Hey Greenwood, it's Robert Stevenson with Greenwood Calendar. I'm here at Self Regional Hospital. This is going to be an important day. You're going to get the answers to the questions you've been thinking about. And as a matter of fact, if you go ahead and list any of your questions in the comment section today, we'll get those answered for you right away. This is Talking Greenwood with Mayor B, and you know what happens there. You hear all about Greenwood, but today is about vaccinations, all about the tiers of things you didn't understand, the things that you are curious about. We have Mayor B, Brandon Smith, is going to be speaking with Dr. Matt Logan here today, and I get to sit in. Hey guys, how are you?
Hey, what's going on?
Okay, put my mask.
Welcome to another episode. I'm going to get kind of right into it, and like Robert said, if y'all have any questions, just type them out. Robert will read them out to us. I'm going to try to make sure I speak up so everybody can hear me. But I'm here with Dr. Matt Logan, who is Greenwood native and also stuck around to work as a doctor and hospital administrator here. What is your official title, Matt?
I'm the Chief Medical Officer and Vice President of Medical Affairs.
Good deal. Good deal. Well, I'm of the opinion that the light here is at the end of the tunnel. Some people may disagree. I think maybe if you disagree, you might have to just squint a little bit to see it. But I think it's there. Hopefully, Dr. Logan would agree with me. I don't know, but we're in part and parcel of that is this vaccine. This is what we've been waiting on. So I'm going to turn it over to Matt. Matt, we've got the vaccine right now. When I say we, I'm talking about the hospital. And am I right that right now you can get it if you're in Tier 1A? Is that right?
That is correct. The tiers are available if anyone wants to look on the internet on the South Carolina DHEC site. But basically, the big broad category in 1A is everyone who's 70 years and older, plus healthcare providers that work in the healthcare setting. And then also recently added last week are parents of vulnerable children, specifically for special needs kids and children with disabilities.
Okay. So anybody 70 or older, and then you also have healthcare providers, and that's, I'm assuming, anybody that works, not just doctors, nurses necessarily. Who all would that cover?
Sure, that includes not only folks within the hospital, but also community providers. We've reached out to all the private medical practices in Greenwood. We also included the dental community, EMS, police who respond to first responder roles, as well as fire who responds in first responder roles. And we've tried to include not only Greenwood County, but the surrounding counties as well. I know we vaccinated a number from Edgefield County over the weekend, and certainly open to continue to do that for our counties surrounding us as well.
I've got a question.
Sure.
This is from Gail Bennett. What if you do private home health care?
Private home health care. This would be like a home health nurse that does in that setting?
I would imagine, yeah.
Home health nurses, yeah, we'd be glad to vaccinate home health nurses. Now, like say if someone cares for an elderly parent, they don't necessarily qualify yet under Phase 1A, but that will be coming, but it's not there yet for that situation.
You know, I find that interesting considering parents of vulnerable children are eligible, but not caretakers of vulnerable adults. I don't claim to know the difference in what the vulnerability of children versus elderly folks are, but I think that's interesting.
Sure.
If you're a medical provider, or if you're in the healthcare field, I'm assuming that your employer has given you some direction, but I mean, you have to show up with papers showing that you're a nurse, or what do you have to do?
We have you attest to it that you're a frontline healthcare provider, and you'll be asked what your role is. That's essentially that.
Don't come in here lying and say
That's right.
You work in healthcare if you don't. But
That's right.
so Tier 1A comes first. How about I'm going to show my smarts here. I'm assuming Tier 1B comes next.
That's right.
How long do you think it'll be until we get from Tier 1A to Tier 1B?
I think it's going to depend on how much vaccine the state gets, to be honest. You know, if the amount of vaccine allotted to the state is kind of slow on the current pace, it may take several months to get to 1B. Now, on the other hand, if it opens up and instead of the state receiving 60,000 doses per week, we get 200,000 or 300,000 doses a week, it may open up way quicker.
And what is that based on? I mean, that's the doses that are coming into the state. Who determines that?
It's between the state and the federal government.
Okay,
So determines that, and DHEC helps regulates how much each individual hospital or community gets.
Okay. So DHEC then is DHEC distributing it only to hospitals, or how do they get it out?
Good question. And to start with, the Pfizer vaccine went mainly to hospitals, and the Moderna vaccine went primarily to long-term care facilities through pharmacies, through contracts specifically with Walgreens and CVS. Now, over the last week and a half, it's been opened up to a lot more pharmacies, to include Publix. My understanding is that CVS, even in Greenwood, is going to be able to start vaccinating soon in other locations.
Okay. So my parent, and that would be the Pfizer and Moderna.
Moderna is what will be given at the other locations.
Okay.
The hospitals. The main reason for that is the Pfizer vaccine requires a very significant deep freeze state of negative 80 degrees Celsius, and a regular freezer like you have at your home will not go that cold. And in fact, we've been fortunate here at South Regional to be able to partner with the Genetics Center, and they have loaned us 2 of their very large negative 80 degree freezers to be able to house the vaccine here on site.
That's great, and we appreciate everybody chipping in during this time.
And it's been a great partnership with the Genetics Center, been super helpful.
That's great. Do y'all as healthcare providers favor Moderna over Pfizer? I mean, seems like the effective rate is roughly the same, but I don't know. What do y'all think?
They're equivalent. Both vaccines have around a 95% effective rate, which really kicks in about 2 weeks after the second dose. So they're both very effective, and the similar side effect profiles. Both are RNA-based vaccines. The main difference is the Moderna doesn't require as deep a storage state. It has to do with the lipid that the RNA is kind of emulsed in. But regardless of that, the Moderna doesn't require as deep a freeze. That's why it's easier for commercial pharmacies to be able to distribute that vaccine.
So, and again, I don't know if anybody's out there making decisions based on whether it's Pfizer or Moderna, but y'all have all Moderna, and then the pharmacies have all the Pfizer.
It's opposite.
Excuse me.
Yeah,
y'all have all the Pfizer.
Right.
Pharmacies have all the Moderna. Do y'all have any of the Moderna also?
We do not.
Okay.
We do not have any Moderna currently.
And then
that may change, but as of today, we don't.
There's potentially a third and fourth and fifth option maybe coming out at some point.
Yes, I'll tell you. One of the vaccines I think a lot of healthcare providers are looking forward to is the Johnson & Johnson vaccine. It's coming out. It's somewhere expected around the beginning of April. And this vaccine is different than the current RNA vaccines we have available. It's an adenovirus-based vaccine, which basically uses like a virus that its normal genetic material is taken out, and it injects basically kind of like an RNA-based product into you instead of using a lipid base to distribute the vaccine. But the good thing about it is it can be stored at refrigerator temperatures, and it only requires 1 dose. So it doesn't require 2 doses, and that will really allow us to get out in the community more in maybe some underreached areas otherwise, and not have to worry about the second dose and scheduling the second dose of vaccine. I think that's really where we're going to really make a lot of headway with being able to open it up to a lot of potentially underserved communities that may not have transportation to the hospital or to a pharmacy to get it. So we're looking forward to that.
That's great. So that's what, 3 months out maybe?
About that. And the efficacy on the Johnson & Johnson vaccine is around 90%, which is also really phenomenal when you consider that the normal flu vaccine is only around 60% efficacious. So it's still a very good vaccine.
And the others, the Johnson & Johnson, Moderna, Pfizer, they're all 90% and higher. Am I reading that right?
Yeah, in the studies, the Pfizer and Moderna are both 95% effective at preventing coronavirus in their studies, very large studies. The Pfizer study had over 44,000 participants in it. Moderna similar. The Johnson & Johnson vaccine is 90% in their study population at preventing future COVID infection.
I'm getting lots of questions.
Good, go ahead.
Okay, I'll combine a couple. What about clergy? Where do we go to get the shot? And I take care of elderly people. Can I get one?
Sure. Currently, we're just having to follow the DHEC guidelines. As the DHEC guidelines change, and the governor is apt to change them at any time. He actually moved the 70-year-old crowd, 70-year-old and plus, from 1B into 1A. And so that was at his discretion to do that.
Before that, it was what, 70?
Before that, actually, 75 and older was in 1B.
Oh, okay.
And in category 1B would include also like school teachers and also certain industries and things like that, folks that work in those settings. So it's really, we're following the governor's guidance. And as of today, some of those folks who, like say, care for a family member at home wouldn't qualify. But I mean, if that has changed, then DHEC will release new guidance, and we look at that frequently, and also have calls with DHEC, and the hospital has calls with DHEC and the South Carolina Hospital Association every week to get updates on recommendations.
So I guess to answer the question, again, we're just following the guidelines set out by the state, but it doesn't list clergy in tier 1A yet. You know, in terms of healthcare providers, maybe there's a very concrete definition, but I mean, I hear these questions about, well, I take care, I'm a home health nurse, or I take care of elderly. I mean, it depends, I guess, what your definition of healthcare provider is.
Sure. Again, we're just following the DHEC guidance at this point, and if the governor changes that, we'll be glad to vaccinate that.
But the DHEC guidance, it defines health. I mean, again, I think I may hear someone who works as a home health nurse and think, well, they're in healthcare, but the state does not define home health nurses or people that sit with elderly folks as in healthcare. Am I hearing you right?
A home health nurse would qualify as phase 1A.
Okay.
So it's not a home health nurse, but say if someone like me, I'm in healthcare, but say I've worked not in healthcare and I was taking care of an elderly parent or something, I would not qualify unless I was 70-year-old. Right.
Gotcha.
Informally.
Right.
Correct.
How about possible reactions, and how long will the protection last after the second dose?
It's a very good question.
And I think that's a good question to get into. If you're skeptical about the vaccine, why should you not be? I guess along those lines.
Sure. So potential side effects. The biggest thing most people have, and it's around 80% of people will have a sore shoulder. That's very common after you get the vaccine. It lasts about 24 to 48 hours. Some people may develop some mild flu-like symptoms like low-grade fever, some joint aches, kind of fatigue. To be honest, it's very similar to other vaccines that folks may be familiar with, like the shingles vaccine. It also causes a very similar, we call it reactogenicity. It's actually not a bad thing. It seems to be more pronounced on the second dose than the first dose. And that's really a good sign that your body's cranking out some antibodies and really getting a good immune response. In the Pfizer study specifically, what that showed was that the long-term immunity to future COVID infection is actually greater if you get the vaccine than actually if you contract COVID itself. The antibody response, 3 to 6 months after COVID vaccine in the study population is very robust. And as far as how long it will last, they're not 100% sure yet. Tim Mullinex is the medical director for Pfizer vaccine development, and I was fortunate to be able to participate in a conference call with him and some others through the South Carolina Hospital Association, and some of these questions were asked. The current thought is that it will probably be about every 2 years a booster shot, It could be 1 year though. They're not sure yet because it's only still kind of in development. And they're following the study participants for several years, and they'll be doing antibody titers and things like that on them periodically. And we will know more as more time passes. But it will be expected a minimum of a year, but could be a 2-year vaccine. It's just to take some time to know when the boosters will be needed, if that makes sense.
And, you know, I'm sure you can get on the internet and Google vaccine reactions and find some anecdotal stories of people having reactions, but it sounds like it's generally a safe vaccine. Would that be your opinion?
Yes.
I don't need to ask a leading question there.
No. Yes, it's a very safe vaccine. And when you compare it to others, I mean, we've given over 5,000, well over 5,000. We gave 5,700 vaccines this past week. You know, we've had no significant anaphylactic type reactions, which are the ones like a severe, like allergic reaction that happens almost immediately at all. And really, other than some kind of expected side effects or reactogenicity side effects that are expected, we haven't had any major reactions that I'm aware of.
Right, good. And I think some people are concerned about the vaccine running out. I think you had told me last week that the states released, basically said, give all your shots when you're coming back for the second shot. We'll make sure you have enough then, right?
That's right. So again, these things are in flux, and we'll say one thing based on the information we have at the time, and then it'll change based on something updated that the governor or DHEC will say. So we were anticipating about 1,500 new vaccines a week is what we're kind of anticipating based on what we were seeing about 2 weeks ago. And so, you know, knowing that we had to give a second dose 3 weeks later, we were holding on some of that inventory because we weren't sure what our future supplies would be to be able to give that second dose when the time came. But the governor, I guess a week and a half ago now, came out and said, let's just change that plan. You guys give everything that you can get your hands on, and we will give you. We will ensure that the second dose is there when the time comes. And we get once a week we'll get a shipment of Pfizer vaccine in to be able to meet that. So. So that's, again, we're basing our decisions in our vaccine clinic based on what we're being told by DHEC and the governor. And so it allowed us to give more than 1,500 vaccines this past week, which was what we initially thought. So, so we basically almost four times that. So we were really pleased actually to be able to do that. And those that have been working in our clinic, it's such a blessing to be able to give this vaccine out, and people are so appreciative, and we're just super glad we're able to partner with the community and do that.
And I guess a dumb question here, but the first shot and the second shot is exactly the same thing, right?
It is. It's the exact same shot, exact same milligrams of vaccine that's given. The first one gives you an initial kind of exposure to this new protein that your body hasn't seen before, and you get a baseline little low-grade immunity, and then that booster really kicks it into gear, giving you that 95% immunity after the second dose. If you only were to get one dose of the vaccine, it's estimated around 52% immunity if you don't get the booster after the 3-week period.
Gotcha. People that are in, I'm kind of jumping around, but people that are in Tier 1A, let's say for whatever reason, they can't get here to get, let's say they're in a coma, I don't know. They can't get to get their shot until we've already moved on to Tier 1B. When you get to Tier 1B, for whatever reason, whether they're skeptical of vaccines or whatever, if you're in Tier 1A, can you still get it? Your time doesn't run out, I guess, does it, for Tier 1A, or can you still get it during Tier 1B?
Yeah, you can still get it.
Okay.
Yeah, it just adds another group to the population who's trying to get the vaccine at that time. So if you're in that 70-year-old plus, this is the time to get it before it opens up to the next phase for sure. Okay,
and again, Dr. Logan said this is all on DHEC's website. But you mentioned again, if you could just remind everybody, Tier 1B would be who?
It includes groups like the school systems are the big ones to me, and I've had some conversations with some of our superintendents in the area, and we are looking forward to helping vaccinate, our school teachers and staff that work in those areas. And so that's a big one. Now, another one, a big one is like other what's considered essential workers that may not be in healthcare. For example, like say folks that may work at a factory. I mean, there's a bunch of plants, for example, in the community. Fuji, Lonza, Capsule is Lonza, I guess, but it's just
Right.
et cetera. Just that really we would like to help them as well. But those would be some 1B participants.
And so then it goes from 1B to 2, or is there a 1C? Or?
There's a 1C, and that's the 65 and older
Okay.
group, basically. And then after that, we go to 2, which is basically everybody.
Okay. So if you're in group 2, which I think all of us in this room, spread out, are in, be patient. There's folks that need it a lot more than you do, unless you got some underlying condition. But be patient. It's coming. Any other questions?
I've got a question. What about the different strains? I hear the South African strain, for example. Will the current vaccinations handle the different strains that are out now?
That's a good question, and so far we think they will. There's been a lot of folks looking at that very question, and we do think that the current vaccines that are available, specifically Moderna and Pfizer, will cover those strains. You may remember or recently in the news there was a UK strain. They found a few folks in the United States that have that strain as well. So that one is more infectious than the current strain that's more common right now. So, but fortunately, the vaccines that we do have are thought to protect against that as well.
I guess that's my question. Is what I've read is they're not necessarily, and correct me if I'm wrong, these other strains, and maybe there are a few, but they're not necessarily more severe in symptoms, they're just more infectious. Is that right?
Yeah, that's the initial thought on those, and they're still looking into it. There's some recent articles that have come out that think that they may cause some more severe disease, but there's a lot of unknowns. The big thing is that particularly the UK strain is more infectious, and it spreads from one to the other much easier than the current strain.
And I guess just kind of getting back to it, if you want to get the vaccine, what do you do? Do you just show up here? Do you make an appointment?
Yeah, good question. So it's appointment only, and one of the things that first happened when some older folks started getting vaccines is you may have seen on the news where they had big lines, like in some Florida hospitals, wrapped around the street, people camping out, and those type of things. We didn't want to get into all that here. We have 2 ways that you can schedule an appointment to get a COVID vaccine here. The easiest one is to use our website, and that's www.selfregional.org. There's a link at the top of that page that'll take you to kind of our COVID information area, our website, and then right in there's a link to the COVID vaccine form, COVID vaccine request form. That's the easiest way to do it, and if you put your information on there, one of our schedulers will give you a call. Make sure the phone number you put in is accurate and that you pick up when we call. We're not really able to leave messages very well, so if you can pick up when we call, it'll make it way easier. So if you see a 725 number, that's the hospital extension. And just make sure you answer that phone.
Is that 725 area code?
No,
You're talking about just 725.
Yeah,
7229.
it'll probably come from a 725-4111 or something like that. That's just the hospital's number.
864
Yes,
725. Okay.
exactly. So if you see a number you may not recognize and you recently filled out that COVID form, we have been pretty successful in calling most people within 48 hours and scheduling. We are scheduling right now for this week and next week. And we do have a number of appointments available. We're also opening up our phone lines tomorrow, Tuesday, from 9 to 12, and for call-ins. We recognize some people may not have easy access to internet, and so we're doing 2 days this week, tomorrow Tuesday and Thursday from 9 to 12. That number is 725-3555. We'll say it again, it's 725-3555 from 9 a.m. till noon, Tuesday and Thursday this week. We'll update that kind of weekly as we go along as to what days that line will be open. But we're trying to get the word out. So again, if you fall into that phase 1A, that'd be a good way to schedule as well. Or the web form also will work very nicely as well.
And I know you probably don't know how y'all's appointments are to the minute, but let's say if I was to get online right now and and seek an appointment, would I be able to get in this week, or we're looking at next week?
We can probably get you in this week right now. We particularly our phone call lines tomorrow, we really want to fill this week up as much. We'd like to start with this week and get as many people as we can get done this week, and then as we go into next week, if that suits you better, we can also kind of look at that time as well. But we would love to fill this week up. We have a lot of availability. We do have the resources this week as well to be able to administer the vaccine, and we think we could probably do a couple thousand, 2,000 or 3,000 this week, depending on the demand.
Any other questions we got, Robert?
We do have folks asking about their different categories. I will list that. I will put the SCDHEC list on there of the different phases. This person was asking about when will the military get it, and another person, what if I turn 70 in April?
I guess you qualify in April. I don't know.
Yeah, they would. We're at the hospital. We're not trying to, cause any hardship for anybody, but we're also held to follow the DHEC rules right now. This is very tightly regulated by the state government, and so we just have to follow those guidelines pretty strictly.
And what about military? Do you have any idea?
I don't know off the top of my head. I'm sure it'll be on the South Carolina DHEC site. I can't call that one out.
I mean, my goodness, I would hope the military would let you know also. But did anybody ask how big the needle is?
No, not yet.
How big is the needle?
It's about like that. It's a little tiny needle.
Okay.
It hardly feel it at all.
All right. Good.
My-
I'm a big wiener.
My wife's had it as a nurse here, and just like the doctor said, she didn't feel hardly anything from the first one, had a little arm soreness on the second one. So,
Yeah.
and now she's immune for at least a year.
At least a year, yeah.
Right.
Hopefully it'll last longer than that, but at least a year.
Well, if you are scared of needles, just remember that it's much preferable to having to wear these everywhere, not being able to attend events, or possibly being admitted to the hospital here or having to seek medical treatment. So it's you can do it. I promise. It's coming from someone who runs around when the nurse comes in with the needles. So.
Watching the county manager or county disaster manager, I forgot what his George. He was saying that the usage in the hospital at one point went over 100% in terms of the beds used. In terms of I think you had more beds, but in terms of staffed beds, it went to like 101%. How is it now?
That's true. Several weeks ago, basically we were at capacity and we were holding patients that needed to be admitted in the emergency department waiting for beds to open up. Fortunately, that has gotten better over the last couple of weeks. About 2 weeks ago, we peaked in the hospital with over 80 COVID positive patients in the hospital at any one time. As of this morning, it's down to 57. So we hope that the big spike that we saw from Thanksgiving and then Christmas and New Year's is hopefully starting to wane a little bit. The numbers are still really high relative to where we were, say, in October. But hopefully the trend is heading in the right direction, or we're hopeful. And we'll take it a day at a time.
That's it for the questions.
That's it? Good. Well, if you're in Tier 1A, or you're not sure, check DHEC. But if you are, please give them a call here. If for whatever reason you can't figure it out, or you're not available, then call Publix, call CVS. Where else did you say? I know y'all weren't.
Yeah, I think some of the grocery stores around. I want to say the Ingalls and Abbeville, I think, is administering. There's some others. That's also available on the DHEC website. There's a South Carolina map, and you can see the other locations that are vaccinating. I know the pharmacies, at least last week, their appointment slots filled up super fast. Within an hour and a half, 2 hours, at least the public site had filled up very quickly with requests. I don't know how much vaccine they're being allotted, but we don't care who gives you the vaccine. We just want y'all to get vaccinated so we can, the community keep you safe and healthy. So we're glad to help, but there are other options.
Yeah, and so anywhere, and I guess you're not going to find any just fly-by-night vaccine providers. I mean, I'm assuming you have to be licensed to get the vaccine. So as such, I'm assuming everybody that's licensed to give the vaccine is on that DHEC website.
Yeah, DHEC regulates that very closely as well, and you have to be an approved vaccinating site by DHEC to be allotted any vaccine. You can't administer it unless if you're a designated vaccinator by DHEC.
Gotcha. So,
Self-regional staff has been doing an outstanding job so far, and they go on, but it's
I
just
would like to
bragging about the staff.
second that motion. I know that they have been working overtime for especially the recent few weeks and even beyond that. So we applaud everything that all the employees and staff here have been doing. So thank you all for keeping us safe.
Yeah, if I could give a shout out, let me tell you, the staff here is amazing. The volunteers that we've had, from nursing to registration, just the effort across the organization with the vaccine rollout, as well as just caring for these patients. It's been a long year since COVID started, around a year ago now, a little less than a year, but pretty close. And to kind of hopefully see the key to end this thing and the vaccinations and the folks that we have willing to help and working on Saturdays and Sundays to help get the vaccine. Some truly amazing people we have in our community that work at this organization. I'm proud to be a part of it.
Tara Bell said, "I have had family and friends vaccinated, and everyone is bragging on the staff." So
Good.
That's great. That's great. Well, from not only the staff in here, the ones administering the vaccine, the ones sticking that thing up your nose
Absolutely.
as well.
Absolutely.
I mean, we applaud them. So anyway, thank you all, and please check the DHEC website and get vaccinated as soon as you can, whenever you qualify.
well, there you go, Greenwood, for Mayor B and Dr. Logan. This is Robert Stevenson with Greenwood Calendar. We'll see you soon. Bye-bye.